Glaucoma is a disease that affects our optic nerve, and not to get too technical, but the optic nerve connects the eye to the brain. And so anything that our eye sees, it has to send that information back to our brain, otherwise you don't see. So glaucoma is a disease process that damages that nerve slowly over time. It kind of makes it waste away, is a way to think of it. The initial symptoms of glaucoma, it would be nothing. That's the tricky part. You can lose a substantial amount of your vision without realizing it. Part of that is because it takes place so slowly. If it happened overnight, you would wake up and notice it. But when it's spread out over a year, you would lose vision, the outer parts of your vision. But some people will start to notice that and appreciate like dim spots or dark spots or a dark area creeping into their vision gradually. So that would be the earliest symptoms that people would notice. And if we catch it at that level, usually we can't restore that vision, but we can stop it at that point. The way we most commonly diagnose glaucoma would be just on optic nerve examination. So looking on the inside of the eye, just the way that nerve looks is the most common way that we would be able to diagnose glaucoma. Some of the main risk factors for developing glaucoma would be having a family history, that is, having a relative that has a history of glaucoma. Having a high eye pressure or having a history of elevated eye pressure puts you at risk for glaucoma. Being over the age of 40 also increases your risk of glaucoma, and the older you get, the more that risk increases over time. And then the final group of people that are at risk for developing glaucoma would be people of African or Hispanic descent. So once we've diagnosed glaucoma, there's a number of different ways we can treat it. The most common way we treat that is with medicated eye drops. They're very effective, and typically they're something that you have to instill once a day. Another way we can treat it, which there's a laser surgery that we can do that can lower the eye pressure as well. For more aggressive forms of glaucoma, there's actual surgery that we can do, but because the medications and laser are so good, it's pretty rare that someone ends up needing surgery. With our current medications and laser treatment, we're very successful in treating glaucoma. It's rare that we have a case that continues to progress beyond our ability to treat it, which is quite remarkable compared to maybe 30 years ago. So the most important thing you can do to address glaucoma would be to get a regular eye exam and have your eye pressure checked and have an ophthalmologist examine your optic nerve to assess the risk of developing glaucoma and keep a close monitoring for any signs or symptoms of it.